Hello, let me begin by thanking the organizers of the 9th ARESA seminar for inviting me to this meeting. And it's always a pleasure to attend the ARESA seminars, especially being an alumni of the ARESA program. My task today is to talk about COVID-19 vaccine uptake challenges in Kenya. And the outline of my presentation will be as follows. I look at the COVID-19 situation in Kenya, and then the COVID vaccine access in Kenya, and end by looking at the issues of freedom to choose the vaccine. With regard to COVID-19 situation in Kenya, the first case of COVID-19 was diagnosed on March 18th, 2020. We are currently on our fourth wave. The first wave had a peak in August last year. The second wave peaked in November and then came down. The third wave was in February this year. And the current wave started late June, beginning of July. And as you can see from the chart, we are doing well as a country. We are managing it, and the numbers are coming down. With regard to the COVID-19 vaccines, we started vaccinating in March this year. Currently, the vaccine that is widely available is the AstraZeneca vaccine, and the bulk of the vaccine we received from the COVAX program, where we received 1.25 million doses. And since then, we have had some additional doses from friendly governments like Denmark, the UK, and so on. We have more recently been promised to get 400,000 doses of Pfizer from the US government, but it has not arrived yet. And the government has also ordered 13 million doses of the Johnson & Johnson vaccine. It is expected towards the end of this month. The government targets to vaccinate all the adults by June 2020, and this was announced by the government, by the president, in June this year. What about the issue of COVID-19 vaccine access? So Kenya has a population of 50 million. To date, we have given about 2.8 million doses of the COVID vaccine. 2 million have received the first dose, and because it's an AstraZeneca vaccine, we require 2 doses, and only 800,000 people have received the second dose. So with regard to the people who are fully vaccinated in Kenya, it's just about 3% of the adult population. If you look at this picture, how does it compare with the rest of the world? This is a picture that is showing projections as to when the bulk of the people will have been vaccinated in various countries. The countries in dark blue are the ones that are doing fairly well and hope to achieve full vaccination of the adult population by the end of 2021. And this is North America, Europe, China, Hong Kong, and Singapore. The countries that are light blue are the next in line. And although you can see that Kenya is not amongst those countries that hope to achieve this target by mid next year, the government is hoping that it will do that. This estimation is from the Economic Intelligence Unit, and from this unit, it is expected that the country of Kenya will have achieved the target by the end of next year and not mid next year as projected by the government. The current status, which countries are doing very well? We can see the United Arab Emirates is really doing well. Spain is also among the countries that are doing well. And this picture does not have African countries, but there are 2 countries that I need to mention in Africa that are doing fairly well, and that is Seychelles and Morocco, with about 50% of their population already vaccinated. Back to Kenya, with regard to the National Vaccination Plan, the government rolled out the COVID vaccination, and it was to be done in 3 phases. They identified 3 priority groups. The first one was the healthcare workers, teachers, and members of the uniformed forces. And this was because they are at risk of exposure or getting exposed to COVID just by virtue of the occupation, the healthcare workers as they interact with patients, teachers as they interact with students, and the uniformed forces as they interact with the public in maintaining law and order. The next priority group was what we considered vulnerable population. These are the people who are at risk of getting more severe disease and even dying from COVID, the elderly, and in this situation, Kenya defined the elderly as people who are 50 years and above, and then people who are younger or from 18 years and above, but with comorbidities like high blood pressure, asthma, diabetes, cancers, renal disease that predispose them to getting severe disease in the event that they get infected with COVID. Then the third category were people in the hospitality and tourism industry, and this is largely because of the economic consideration, because Kenya's main foreign exchange earning is through the hospitality industry. Unfortunately, when the vaccine arrived, things changed. The well-connected people had access to the vaccine even before the priority groups that had been identified. And to make it worse, the government allowed foreign diplomats to access the vaccine. And because these vaccines were in short supply, it created a huge shortfall. So what you could see thereafter was long queues of ordinary Kenyans who had no access, not well connected to be able to jump the queue. And the people who are healthcare workers, people who are elderly, who were forced to join these queues because of the shortage of the vaccine. And you can see from this diagram, there are very long queues. People would queue for hours and only arrive near to the vaccination point, and you're told that the vaccine has run out, and asked to check for availability of the vaccine in other vaccination sites. This is just a frustration shared by one of the Kenyans, somebody who works with the Physician for Human Rights, and it's a representation of the frustration that many Kenyans went through. And here she says, it's been a total nightmare. I've called 8 different government and private facilities today alone, trying to schedule a vaccine appointment for my parents. Each facility has a different set of rules. Some even charge for the vaccine. None had available appointments. So the vaccine situation really reflects what people have been talking about with regard to ethics, the issues of equality, equity, reality, and what people would talk about as a liberation. What would you want to see? And I like this cartoon. This is a match that is going on, but there's a barrier for people not to be able to see the match. And equality says, okay, everybody get a stool, and hopefully you'll be able to see the match. But that is not possible because there is somebody who is short. Even with one stool, he's not able to see the match. Equity comes and says, okay, the tall person can be able to see the match without a stool. He doesn't need a stool. Give the short person the stool, so he has 2 stools. And all the 3 of you are then able to watch the match. And, you know, everybody is happy. But the reality, and this has been shown by COVID vaccine globally, is that the people who have access, they're tall enough, they don't even see the stool, they're the ones with the most number of stools. And the person on the right is the African situation who has no stool, he's short, he's not able to watch the match. Now, what the world has been pushing for is liberation, the picture on the extreme right, where there are no barriers. Everybody can watch the match, irrespective of their height. And with regard to the COVID vaccine, this is where people are talking about waiving patency rights or paying for the owners of the patents by, you know, governments or multilateral organizations so that they don't lose their income, but it makes it possible for the manufacture of the vaccine by many more companies, and especially in the developing part of the world. And by so doing, you have enough vaccines so that everybody can have access to these vaccines. And that would be removing the barrier from watching the match. When it comes to the issues of freedom to choose, we know that there's a vaccine hesitancy is a problem globally. In Kenya, the Ministry of Health did an assessment, and they found that 25% of the people were hesitant to get the vaccine. And this is the data dating from April this year. What were the factors that was associated with this vaccine hesitancy? One was age. The younger people were more reluctant to get the vaccine. Level of education, the people who were less educated were more reluctant to get the vaccines. What were the concerns with this vaccine? One was safety, and the other one effectiveness. The people who felt that the vaccines had been developed so quickly, they might not be effective, they might not be safe. There are people who were hesitant to get the vaccine based on religious beliefs. There are those who were affected or influenced by the social media, and these were largely people whose primary source of information was the social media. There are those who did not trust the government, they just lacked trust on the government. Whatever the government told them was good, they had mistrust on it and they thought the other way. And then there are people who had low perception of the risk of infection. They had not seen anybody who had COVID, they had not seen anybody who had died from COVID, and they believed therefore that they were at a very low risk of getting COVID and they did not need the vaccine. Of major concern for the government was the low vaccine uptake among the civil servants. Now, to address this issue of vaccine hesitancy, the President and the First Lady received the vaccine in public, which was a very good thing. But it was also reported that he ordered the cabinet to get vaccinated, which had some issues. So there were feelings of, coercion and abuse of their human rights, abuse of their privacy, and even abuse of their human dignity. And so this is the clip from a newspaper showing the president ordering the cabinet to get the COVID-19 vaccination. Later on, because of the low uptake of the vaccine by the civil servants, the head of the civil service made it an order that all the civil servants required to get the vaccine by August 23rd, otherwise they would face disciplinary action. And one of those disciplinary actions was actually that their salaries were going to be stopped. Now, immediately there was an uproar, especially by the civil society, and this a court summons to the government to attend court, where a matter was to be heard and determined on the legality of the action. Now, the people who were against mandatory COVID-19 vaccination had several reasons. One, they felt it was coercion. They felt it was an abuse of the right to equality of the citizens. It was discriminatory. It was an abuse of the human rights of the civil servants. It was against the freedom of conscience, religious beliefs and opinions, and it was against their right to privacy. The government argument was that some public servants have deliberately avoided getting vaccinated so that they can stay away from work under the guise of working from home. And the government felt that that was not justified. Now, those who supported the government, the pro-mandatory COVID-19 vaccination, had several arguments. One, they said they agreed with the government based on economics that the public servants were being paid a salary to work, and they could not pretend to be working from home because we know that they don't have the facilities to be able to do that. The others felt that by not being vaccinated, they were putting other people at risk. So, for example, the teachers will be putting their students at risk. The healthcare workers will be putting their patients at risk. The others who argued from a utilitarian ethical theory that you'd rather have a few people inconvenienced but protect the bulk of the population. The issue of maximizing on good, the beneficence theory that by people being vaccinated, the general public would benefit. And so that was from a public health perspective. Interestingly, there's some people who argued from reciprocity that the government has been very good to the civil servants. When everybody was being laid off because of COVID, the government did not lay off anybody. When companies were reducing people's salary, the government did not do that. And it was just right that the civil servants also reciprocate. Fortunately, the president stepped in and reversed that order, so it's not a requirement anymore. So in summary, the ethical concerns around COVID-19 vaccination rollout in Kenya have been around equity, discrimination, fairness, autonomy, the issues of coercion, the issues of abuse of human rights, the issues of preserving privacy and preserving freedom of choice, religious belief, and opinion. And I just end up by thanking you for your attention and to thank the healthcare workers who take care of